you can expect that a biosimilar will have the same side effects as the reference biologic drug. Just as you can expect it to be equally effective, it will also have the same list of toxicities. So that's a strength, I think, of biosimilars, that we're through that FDA approval process. And now, as I said, for 6 years or so in the clinic, we've had experience with these drugs through infliximab or Remicade biosimilars, and the side effects appear to be similar. If the side effects were different significantly, or the effectiveness was different, if the chemical was significantly better, significantly worse in terms of how effective it was at treating disease, it wouldn't be approved as a biosimilar. It would potentially be approved as a different drug, as a new drug of its own. You may have heard of the placebo effect. So the placebo effect, we may or may not use consciously in clinic. It's the beneficial effect of subjective factors about a drug. There's also potentially a nocebo effect. And I wanted to tell you a little bit about this kind of carefully as we talk about biosimilars. Two, actually not recent, 3 or 4 year old clinical studies that were done on biosimilars in Europe with infliximab biosimilars in people moving from Remicade to Inflectra. One study was totally blinded. It was called the Switch study. It took place in Norway, and it switched people from Remicade to Inflectra. So it was the Switch study. 240 people switched, 240 people stayed on Remicade, and they were blinded. They didn't know, and their doctors didn't know which group was which. And a strength of this study was that it was a pretty big study. It was the first such study to have this kind of blinded switching. And it included people having multiple different autoimmune diseases, including rheumatoid arthritis and ankylosing spondylitis. And the same numbers of people had disease flares and side effects in each group, which is pretty reassuring to me. And I tell my patients about this. But after this, a study was done that was not blinded and not controlled in that same way. So people moved from Remicade to Inflectra, and they knew about it. And they were compared to a smaller group that wasn't moved, that continued on Remicade. And the authors of this study noted that more people developed problems, joint pains in the case of rheumatoid arthritis. They had concerns about side effects and switched back to Remicade or switched off of that to a different biologic compared to the group that stayed on Remicade. And the authors looked at the two studies and said, this is new. This is unexpected that more people had trouble with this. The only difference between these studies was that they and their doctors knew that they were taking a new drug. And so they thought maybe there's something important about the way in which that transition is communicated that bears on the effect of the drug. It's not totally clear if this is the case, but a lot of us reading this study realize that we have an opportunity as we're taking care of people, and especially this summer and this fall in advance of 2023 and adalimumab biosimilars coming. I'm taking the opportunity to tell people a little bit when we have time in clinic about the FDA approval process, that it is robust in my view, and that biosimilars are expected to have the same safety and efficacy so that people are comfortable with it in case they transition to a biosimilar in 2023, that maybe that optimal communication about the medication, positive expectations might be helpful.